Good morning, good afternoon, good evening, good day, wherever you are. It's me again, the pediatric medical coach. How are we all doing? I hope we are all fine with our little ones. Um, I'm here again to discuss very important information concerning how medication is shared between um, two siblings or infants. Okay, this has really become a very concerning topic. It's really concerning because you find that we've gone to the hospital. A doctor has prescribed medication for seeing to a particular child. Okay, we've gone to the hospital. That dog, baby A is doing this. So please, I would like for you to check baby for me. And the doctor checks the baby and then gives a particular medication, or the doctor checks your child and then gives a particular medication. And then you find our mothers, okay, or our parents going home and then realizing that, child number B or baby number B seems to be having similar symptoms. Okay, child number B developed similar symptoms. Now, unsure to the parents as to whether this child is actually having the same illness for which the medication was prescribed. They go ahead to then share the medication between these two children. Okay, so baby A or child A was receiving a medication meant for whatever diagnosis that the doctor gave before prescribing the medication. Okay, and then baby B is taking that same medication as a result of mother's own decision, due to she thinking that the two children have similar symptoms. Now, I'm not disputing the fact that infections, cannot be transferred from one baby to the other, or one child to the other. Of course, it happens. But as a lay person, as someone who is not trained to do such, are you accurately giving the drugs? That is my concern. Are you accurately giving the drugs for the purpose of which they should have been administered? Alright, now let's look at this first scenario. A child goes to the hospital, child A again goes to the hospital with probably an infection, from the eye, and then irritation of the eye, and then probably we have congestion of the nose, so catarrh, cold, and then the eyes are itchy and watery, or becomes red with discharge, whatever it is, most especially with discharge. And then mother sends this child to the hospital. The child was given probably some medications to drop in the eye, then also some medications to drop in the nose. And then mother comes back home and after a few days realize that, oh, the other sibling, probably the younger one or the elder one, however it is, okay, vice versa, also developed some sort of itchy nose. Usually what do parents do? They quickly say, oh, last time when we went to the hospital, doctor prescribed some nasal drop or some medication for baby A's catarrh, so let's use it. And then they take it and then put it into the nose of baby B, and then what? Apply it. Okay, what then happens? Assuming that having catarrh or having nasal congestion is most of the time, how am I going to say it? Is a symptom that can be found in most of infections that have to do with the lungs or the nasal cavity, and all of that. Similar symptoms. You can find that symptom in a whole lot of other infections. Alright? And so, how sure are you as a parent or as a mother that is the same infection that this child is going through? Okay, that baby B is going through with baby A. Okay, it could be that baby A is probably bacterial infection, but then it's likely that baby B could be suffering from a viral infection. Alright, or some sort of allergies or something else. Okay, it could also be that if it's bacterial, it could also be that probably the kind of infection it is probably will not be subdued by the medication you are using. Alright, when that happens, what then happens to the child? And then what then happens to the medication? We can say that this has to do with something that can cause, or can lead to antibiotic resistance, most especially if it's an antibiotic that is being used this way. Okay, it can cause antibiotics resistance. If you would like to know more about antibiotics resistance, kindly go over to our page, okay, at PDX Coaching Services on Instagram. Okay, and I also do well to link it in the comments section. In the description box. I'll put the links over so you can go over and then enlighten yourself, get more insights about antibiotics resistance. Now, secondly, what I want to bring your attention to probably is, it has nothing to do with allergies. Probably it's just some little irritation, okay, that probably caused it for baby B, but because you can see that, oh, baby is bringing out this one, immediately you go for that drug and then apply it. There is nothing wrong with going over to check again with your doctor to know if they are both having the same infection. Now, even if they are both having the infection, we do not recommend, as we, in general, health professionals, okay, do not recommend sharing certain medications between two patients. Okay, due to the transfer of infections from the other side to the other person, who likely may not even have such infections. Okay, and due to the side effects, probably because of the different level of severity, probably the dosage you are using from for the first one might not necessarily be needed for the second one. Okay, and even if you go to the doctor, I'm sure the doctor will not be like, oh, if you have it, then the two of them can use it. Most especially if it has to do with what? Eye drops and nasal drops, even ear drops. Okay, it is really not advisable to share drugs in general, most especially if you don't know the history of the child, don't know what is going on with this child. Please do not share drugs, okay, medications between children. Okay, for safety's sake, please do not do that without the right guidance. Okay, if it's due to some sort of financial issues or something, and you feel that, oh, okay, baby is not going to use all, depending on how many days you were asked to give it to the child, and then you feel like, oh, baby B sibling can also take it, still more, find out from your doctor or find out from whoever that you actually took it from, okay, to see if they are allowed, okay, or you are allowed to actually share it between the two of them, and who can take this dosage and who can take this. You understand? But please do not on your own share medications between your children without following the right instructions. Okay, talk to someone for guidance before you do so. Okay, so you don't end up transferring infection from one child to the other. I also made a post about such transfer of infections on our Instagram page. I will do well to link it as well in the description box below. Okay, so I hope I've been able to explain this very well, and I'm really hoping that as parents we will take up this little advice and then do well not to share medications between children. And if we want to, okay, due to financial constraints, or probably because you feel that, oh, you have the medication, why should you go and buy another one? For safety's sake, okay, for safety's sake, always cross check from whoever that gave the prescription for the first one before you do, and then make sure the right guidance is given to you on how you can safely share this medication between your two children, or three, or how many of them they are. All right, so it can be safe. Please and please, I really hope that whatever information I've shared today has been helpful, and if so, kindly like. If you are not subscribed, kindly subscribe, share and comment, ask any questions, so our videos can reach other parents, okay, who are also willing to help their children thrive. All right. So yeah, until next time, we'll see you here next week again, Saturday. For our new subscribers or new viewers, you are welcome to our channel. To our returning subscribers and returning viewers, thank you for always supporting us and staying with us. We hope to always give information that will help you and your child thrive in a healthy manner. So yeah, thank you. Until next time, have a great day. Bye.